Have you ever wondered if going gluten-free is the secret to feeling your best, especially with so many people talking about it today? It seems like a popular choice, but it is important to understand when it is truly necessary for your health. While many choose a gluten-free diet for various reasons, a gluten-free lifestyle is primarily required for individuals diagnosed with specific medical conditions. The most common and critical conditions necessitating strict gluten avoidance are celiac disease, non-celiac gluten sensitivity, and a wheat allergy. These conditions differ significantly in their underlying mechanisms, which dictates the severity and nature of the required dietary changes. Celiac disease, for instance, is an autoimmune disorder where ingesting gluten triggers an immune response that damages the small intestine, leading to nutrient malabsorption and a range of symptoms. Non-celiac gluten sensitivity, on the other hand, involves symptoms similar to celiac disease but without the autoimmune response or intestinal damage. A wheat allergy is an immune reaction specifically to proteins found in wheat, which can be life-threatening in severe cases. Understanding these distinctions is crucial because the dietary approach, the vigilance required, and the potential health consequences vary greatly. If you suspect you might have one of these conditions, the most important step is to consult with a doctor or a registered dietitian. Do not self-diagnose or eliminate gluten before proper testing. Removing gluten from your diet beforehand can actually make it harder to get an accurate diagnosis for celiac disease. Your healthcare provider can guide you through appropriate diagnostic tests, such as blood tests and an endoscopy for celiac disease, or an elimination diet under supervision for non-celiac gluten sensitivity. A key concept here is the distinction between wheat, gluten, and celiac disease. Wheat is a grain that contains gluten, but not all gluten-containing grains are wheat. For example, barley and rye also contain gluten, which must be avoided by those with celiac disease. People with a wheat allergy only need to avoid wheat, not necessarily all gluten-containing grains. Knowing these differences helps tailor the diet precisely to the condition, ensuring you avoid unnecessary restrictions while protecting your health. Adopting a gluten-free lifestyle is a serious medical treatment for those with diagnosed conditions, not merely a dietary trend. By understanding the specific conditions that truly requiring it, you can make informed decisions about your health, avoid unnecessary dietary limitations, and ensure you receive the right care for your digestive well-being.